Good morning. It's October 22nd and this is your daily brief in science. Here's everything you need to know. The COVID-19 pandemic continues to have lasting effects on global health, with a recent study revealing a concerning rise in autoimmune disorders. This research highlights that individuals aged 60 and above have shown consistently high rates of anti-nuclear antibodies, or ANA positivity, both prior to and following the pandemic. Medical researchers at the University of Calgary have identified dysautonomia as a common condition among those suffering from long COVID. Furthermore, there has been a notable increase in mortality rates among younger populations, a demographic that typically experiences lower death rates. The pandemic has also forced businesses to prioritize short-term survival strategies, often undermining long-term sustainability due to disruptions in supply chains. Frontline workers have faced increased inequities during this period, dealing with heightened risks and limited access to healthcare services. In response to these challenges, emerging technology solutions are being developed to support frontline workers, addressing essential needs such as childcare access and vocational training. Additionally, the effective use of social media data is proving beneficial in monitoring public health issues, particularly within marginalized communities. This research has broader implications, enhancing our understanding of social isolation effects across various contexts, including maritime trade and military service. As we navigate these ongoing challenges, the development of flexible support programs for adolescents struggling with self-harm is anticipated to yield positive results by early 2025. The James Webb Space Telescope, a collaborative effort between NASA, ESA, and the Canadian Space Agency, continues to unveil mysteries of the early universe. Recent research utilizing JWST has identified isolated quasars that formed between 600 to 700 million years after the Big Bang, prompting significant questions regarding their formation. These quasars are situated in regions that are less densely populated with galaxies than previously assumed, leading researchers to describe their locations as being in the middle of nowhere. According to physicist Anna Christina Eilers from MIT, the large size of these quasars presents a challenge as it raises questions about the availability of surrounding material necessary for their growth. Traditionally, galaxies grow by capturing gas to form new stars or by merging with smaller galaxies. However, it remains unclear whether these processes were active during the early universe when these quasars emerged. Despite the challenges posed by these findings, experts believe it may be possible to reconcile these observations with existing cosmological theories. The research, published in the Astrophysical Journal, sheds light on objects created shortly after the Big Bang and provides insights into the unexpected presence of massive galaxies. The researchers propose that extreme conditions and abundant gas in the early universe may have allowed for more efficient star formation, contributing to the rapid development of these galaxies. JWST's advanced capabilities, including its near-infrared spectrograph, enable detailed investigations of star formation and the age of galaxies, although it is limited by a narrow field of view. These discoveries align with other findings from JWST that challenge our understanding of the early universe, such as the rapid formation of supermassive black holes. The research team plans to incorporate additional JWST data to further explore early galaxy formation and refine existing models. With approximately 20 years of operations remaining, JWST is poised to continue making groundbreaking discoveries and addressing fundamental questions about the cosmos. The American Stroke Association has made a significant update with the release of its 2024 guideline for the primary prevention of stroke, the first revision in 10 years. This new guideline emphasizes the necessity of screening for sedentary behavior and promotes regular moderate to vigorous physical activity as essential components in stroke prevention. Among the key recommendations is the adoption of a Mediterranean dietary pattern, which has been shown to effectively reduce stroke risk, especially when enhanced with nuts and olive oil. Cheryl D. Bushnell, MD, highlights the importance of recognizing stroke risk factors such as high blood pressure, high cholesterol, and diabetes to prevent initial strokes. For individuals identified at increased cardiovascular risk, the guidelines recommend antihypertensive and statin medications to lower the likelihood of experiencing a first stroke. Additionally, the guidelines address the role of social determinants of health, advocating for improved access to education and resources to lessen stroke risk across communities. A new tool, the Prevent Risk Calculator, has been introduced to estimate long-term stroke and heart disease risk starting at age 30, aiding healthcare providers in making informed preventive treatment decisions. Recognizing the warning signs of a stroke is critical, and the American Stroke Association advises the use of the FAST method for timely intervention. Healthy lifestyle choices, including proper nutrition, quitting smoking, and engaging in regular physical activity, are emphasized as vital strategies for preventing a first stroke. The updated guidelines also include gender and sex-specific recommendations, particularly tailored for women and transgender individuals, to address their unique stroke risk factors. Special considerations for pregnant women focus on managing high blood pressure and screening for complications associated with chronic hypertension. Effective management of blood pressure remains crucial for stroke prevention, though many patients find it challenging to reach target levels with single antihypertensive medications. A recent study from the University of California, San Diego School of Medicine highlights the potential of advanced artificial intelligence in enhancing hospital quality reporting. This research, published in Enigmatic, indicates that large language models can achieve a remarkable 90% agreement with traditional manual reporting methods for hospital quality measures. The study specifically examined the Centers for Medicare and Medicaid Services SEP-1 measure, which pertains to severe sepsis and septic shock. The findings suggest that LLMs are effective in accurately processing complex quality measures, demonstrating their capability to correct errors and speed up processing times. Key advantages of using LLMs include lowering administrative costs, enabling near real-time assessments, and offering scalability across various healthcare settings. Co-author Chad Vandenberg pointed out that these technologies could significantly reduce the administrative burden on healthcare professionals, allowing them to focus more on patient care. Future research will aim to validate these findings and explore the integration of LLMs into ongoing healthcare reporting improvement efforts. The collaborative nature of this study, which involved the Joan and Irwin Jacobs Center for Health Innovation, underscores the importance of teamwork in advancing healthcare technology. Lead author Aaron Bucina noted that incorporating LLMs into hospital workflows could enhance the real-time nature of reporting, ultimately improving personalized care and patient access to quality data. Overall, this integration could lead to a more efficient healthcare system, allowing professionals to concentrate on delivering better patient care. It is important to mention that Bucina has equity in Healthsesio Incorporated, a digital health startup, and the study received related funding, in compliance with UC San Diego's conflict of interest policies. A new study proposes a controversial yet intriguing method to combat global warming, injecting millions of tons of synthetic diamond dust into the Earth's upper atmosphere. This innovative approach aims to cool the planet by replicating the cooling effects of volcanic eruptions through the dispersal of reflective particles. Published in Geophysical Research Letters, the study utilized advanced 3D climate models to analyze the cooling potential of various aerosols. Among the 7 aerosol candidates evaluated, diamond dust emerged as a potentially more effective and less harmful alternative compared to traditional materials, such as sulfur dioxide. The model predicts that this technique could lower Earth's temperature by approximately 1.6 degrees Celsius over a span of 45 years. With global temperatures having risen significantly since pre-industrial times, the urgency for effective climate solutions is pressing. Researchers caution that Earth is approaching a climate tipping point, highlighting the need for immediate action to cool the planet, rather than focusing solely on reducing carbon emissions. However, the implementation of solar radiation management options like diamond dust injection faces significant technological, cost, and ethical challenges. These include the potential for unintended consequences on weather patterns and the necessity for international cooperation to manage geopolitical tensions. Critics of geoengineering argue that such methods could detract from essential efforts to reduce greenhouse gas emissions. Technical challenges also remain, such as ensuring the even distribution of diamond dust particles in the atmosphere to maximize their cooling effect. The study emphasizes the importance of exploring unconventional methods to mitigate climate change, calling for an all-hands-on-deck approach to safeguard the planet. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.